Meanwhile, every minute counts when it comes to responding to a stroke. Local medical experts in San Diego are now shedding light on the leading cause of death for Americans.
In fact, according to the CDC, every 40 seconds on average, somebody in the U.S. has a stroke. Every 3 minutes and 14 seconds on average, a person dies from one. And every year, nearly 800,000 Americans suffer a stroke, with the vast majority of those cases being first or new strokes. So joining us now with the risks, the symptoms, and how strokes affect different people is UC San Diego Health Department of Neurological Surgery Chair, Dr. Alexander Kalesi. Thank you so much for being here to talk to us, Dr. Kalesi. Can you explain to us exactly, for those who don't know, what a stroke is and maybe the factors that commonly cause them?
Sure. Thank you very much for the opportunity to be with you. So a stroke is essentially an interruption of blood flow to the brain, or a bleed into the substance of the brain itself. And so there's not really a more time-sensitive condition in medicine. And for all the reasons that you outlined in the introduction, it's unfortunately a very common condition where we've made huge strides in our ability to interrupt that ongoing insult to the brain. So the signs that patients often experience are a weakness on one side of their body, a numbness, an asymmetry in their face, an interruption of their speech, depending on the part of the brain that's involved. And unlike other conditions, the brain is the organ that tells us in an ongoing way that we're okay. So often the person who's suffering the stroke doesn't actually have insight into what is happening. And so for that third-party observer, that's your kind of everyday opportunity to save someone else's life.
Dr. Kalesi, how does the risk of having a stroke vary with race and ethnicity?
Well, it depends on the type of stroke involved. People in underrepresented minorities, Hispanics, for example, or African Americans, are at a slightly increased risk of that hemorrhagic form of stroke, meaning a bleed into the substance of the brain. And so preventive measures like ongoing control of conditions like diabetes or high blood pressure can serve to reduce that risk. There's no question that access to medical care, particularly for those underserved or underrepresented populations, is extraordinarily important in reducing that overall risk.
And Dr. Kalesi, you talked about the timeliness, the every minute counts. Can you talk to us about what the symptoms of a stroke look like? What should people be on the lookout for? And what they should do if they think somebody is in fact suffering from one?
Yeah, so the acronym we like to use is FAST, which is face, arm, speech, and time. And so an asymmetry of the face, so a droop in your smile if you're unable to lift your eyebrows, a weakness in your arm, an interruption of speech, and then time is really of the essence. If you suspect a stroke, it's quite important to call 911 and allow EMS to respond. Because even in that situation where you're dealing with only a temporary interruption of blood flow to the brain, like a TIA, and there's not a permanent irreversible injury to the brain, it's important to seek medical care immediately so that if there is an intervention that's required, we can intervene in a timely way. You know, we just followed a miraculous story of Leland, a young boy. It really shows that our ability to actually interrupt that process and save the brain has come an enormous way in the last 10 years. And so you really want to make sure to seek medical attention immediately.
So exactly what can be done, I guess, to reverse some of the effects of a stroke? I've seen people have to go through PT and things like that. What else can people do?
Yeah, so 10 years ago, you're right. The care was largely supportive, meaning physical therapy, occupational therapy, supporting someone through the new deficits that they've acquired through a stroke. But we're now in a very different time. So it used to be the only thing we had was a blood thinner called TPA. But about 5 or 10 years ago, in San Diego was one of the regions that really led the development of this technology, is the use of catheters to actually open an obstructed blood vessel in the brain. And that procedure is called a thrombectomy. And that's something that's now available through the use of imaging as far out as 8 or even 24 hours, depending on that person's individual anatomy. And so there are many interventional procedures that are available now at certain select centers, like our Comprehensive Stroke Center, to intervene and restore blood flow to the brain. In patients who've had a bleed into the substance of that brain, that form of hemorrhagic stroke, there are minimally invasive surgical procedures that are available to relieve that pressure and evacuate that blood clot, as we do in trauma patients as well. And so the tools that are available to us as interventionalists and neurosurgeons now are totally different than 10 years ago. And that's a lot of what it's a lot of what we've been able to do to reverse some of the disability that you described.
Yeah, because I remember the acronym, Dr. Kalesi, you're talking about FAST. Tell us again what that stands for. Face?
Face, arm, speech, and time.
Okay, so
droopiness of your face, weakness of your arm, interruption of speech, call 911.
And acting fast,
Acting
obviously,
quickly.
can help them reverse the effects. And incredible to see the developments here in just the last few years as a result. Thank you, Dr. Klesse, for giving us some insight today.
Hey, thank you very much.
All right, still ahead. A young Friars fan is